Hey everyone, so this is Bao, and you've heard about me. I have with me today somebody who is really special. You can say he's my co-host. He actually mentioned the idea of a podcast to me in January, and I had been thinking and thinking about it, since November, December, trying to write my own script, try to see how it would flow. I had this whole idea of what a podcast would look like after doing research. And then Dr. Michael Johnson, he mentioned it. He has his own idea as well, and we actually have very similar interests for the creation of a podcast. It's to raise awareness of all the good activities that surround the world, what else we can do. Um, so we merged, and so here we are. And we tried the script version. It just did not sound good. So we are going to try again. And this time we're just going to speak from the heart. We're just going to tell you, about ourselves, what we want, and then just rant from there. Um, so this guest here needs, or my co-host needs no introduction. I'm not going to do that because as you hear him talk, you will understand why he's very important and special to me. Um, so, Dr. Johnson, hit it.
Well, again, it's a privilege to be here with you. One of the things that impresses me about this whole idea is we have a passion for compassion, and Bao, that's what it got me thinking about working with you with this podcast. We live in a world that readily discards people and relegates them to the dust heap because we see them as of no economic or social value. I have been working in missions and work to help people since I finished my medical school career at in University of Michigan. And upon finishing that, I moved here to Philadelphia to do my training in general surgery. And upon completion of that, I was in practice for a few years before I went to Africa. My wife and I spent 20 plus years in Kenya. And we came back here in 2010 and started an organization called Miriam Medical Clinics, which Dr. Wynn works with us right now. And Miriam Medical Clinics is devised to help the down and out, the downcast, the forgotten, here in the Philadelphia metropolitan area. And again, it's about having passion as having compassion as our passion. The whole reason we do this is because we feel that healing um, is health and healing. Is about more than just providing the right medicine and making the right diagnosis and getting the right X-rays. It's about helping people feel whole, recognizing their humanity, recognizing the importance of their humanity, and seeing them as individual persons, not as just numbers. And our healthcare system sees people as numbers. They see how many people have this illness, how many people are doing this, and what they're doing wrong. And our healthcare system is, you can't even really call it a system. It's a conglomerate of people who are taking advantage of uh, us as individuals by relegating some people to better forms of care based upon how much money they have, and others to no care at all or little care. And so that's why we're here. We're here to alert and involve you in helping us to um, bring others to that realization. We are all made whole when we help each other. We cannot live individually. We are a community of mankind, and that's what this podcast is about.
Now, Dr. Johnson, you mentioned that the healthcare system is like a business model, right? I wanted to ask, when did you come to that realization? Because for me, I had always thought, oh, I want to help people. I go into healthcare field. I never understood that, like in pharmacy school. When I worked as a pharmacist, I did not see that. I just thought, how can there be any type of disparity between healthcare provider and patients? I try my best as a healthcare provider to help without looking at any biases, even though, without realizing that I do have biases myself, or the way we were trained and taught to also be biased against certain populations. I never realized it until I stopped working as a healthcare professional, and when I actually when I was in the shoes of a caregiver, that's when I started realizing it. When my dad started getting sick with cancer, and we had to take him to the doctors, and just realizing that it was a business model um, when you're on the patient side. And that was an unfortunate time to find out. But I think then that was when I started to really think and examine myself, and looking into the public health lens and see what else can be done because the system is so broken. I wanted to know for you, when that was, because I think maybe medical school, healthcare schools like pharmacy, nursing may do a better job nowadays in explaining different ways, right? Like for payment systems or just being acknowledged on the public health side. But back then, it was just more about, you learn about disease, you learn how to treat patients, you learn about drugs, and that was it. There was no other ways. But really, if you look at it, um, us as healthcare providers, at that level, we do care about patients, and I'm sure in the hospital setting as well. But at the higher up, the business executive level, that's where you have, the MBAs, the people who are business running the model. And it's all about extracting, like you said, how do we, how do they get the most payment? How do they make the most money? Um, and it is exactly that. But I wanted to ask you when you realized it, because you're so um, actually much, much more wiser than I am.
I don't know about wiser, but when I was in training in general surgery there at the Graduate Hospital, which is part of the University of Pennsylvania, I was training as a general surgeon, and we had uh, we had several levels of service. Uh, but the bottom level of service were for those who had little or no health care insurance, and those are always 90% of the time people of color, black people in particular. Um, Historically, that's the way it's always been. You had Philadelphia General Hospital, which was torn down shortly after my arrival in Philadelphia, and that was a hospital where poor people were relegated to. Um, but after they tore that down, all of these patients were dispersed throughout the other hospital systems in the Philadelphia region. So they tore down that hospital, financial reasons or whatever, and they sent them to all these other peripheral hospitals, and they were relegated to wards, and and these wards were segregated, not necessarily by color, but certainly by income. And since people of color had the least income, they always ended up on the same wards and the same services. I was, as a resident in general surgery, you had the designation as a chief resident to take care of those who were on the lowest level of care. And a gunshot wound would come in, or a intestinal obstruction. Those people were sent to the lowest level of care. If they because and they so they basically the residents were training on those people. They had little oversight, um, but on the superior levels of care, the primary surgeon was in charge, and that. stuck with me, that I was actually a part of that system. And that is perpetuated across the nation. And for people of color, we were not supposed to even um, have health care. Uh, Originally, as slaves and descendants of slaves, the only reason they kept you healthy was so that you could work. Um, and once slavery ended, the descendants of slaves, there was no reason to keep them healthy because they weren't slaves. They were not the property anymore. You had to fend for yourself. Um, finding employment down south was darn near impossible. Finding employment up north was possible, but the wages were miserable. And so again, you were relegated to places that would provide you rudimentary care or less than the standard of care. So I recognize this just growing up and in my training. This is what it was, and unfortunately, that's how it remains even now. If you don't have the silver, platinum, gold, or whatever type of card you want to call it with healthcare, you are you are in a group of people who go to federally funded healthcare centers. You stand in line or you wait in the waiting room, and you are treated basically as a number.
Hmm.
And that is not healthy. That is not healing. That is not wholeness. And so we started Marion Medical Clinic specifically for that reason. We want people to feel human.
No, thank you. Thank you so much. I feel like you can give history lessons, and it's just so remarkable because to a lot of us, it's probably the first time that we've heard something like that said,
Hmm.
what you had just reminded us, because, you and I, we have that generational difference, and I never experienced it firsthand, never really taught that in school, primary school, college, not really. And I think it's so important that we understand history and think about it. Um, and and only until, I started um, my program, the Masters in Public Health MPH program, do they teach about the history and the reasons behind, and like the root causes of certain disparities. Um, and I think us as a society, we have that. I heard this word the other day. It's collective amnesia, and they had used it for vaccine hesitancy. With the measles outbreak, we think we're safe, therefore we don't need it. This certain type of vaccine, it's not necessary now, and it could potentially have side effects, is what people are thinking. And now we're learning it the hard way that measles is coming back, deadly, deadly virus. Um, yeah, that collective amnesia, that could be applicable to anything, to the way we think about healthcare, to the way we think about treating patients, and stuff like that. So, your your talk about, your passion, and it had already started after you had finished completed residency and medicine school, and you went to Kenya. So you are, I believe, an example of a public health figure. And I was actually listening to somebody who had an MPH, and now she's working, in the public health space for industry. She's an influencer, I would say. A lot of people follow her, and she's great. She mentioned, how it differentiates her because she goes out there and talks to the community than say a nurse practicing. But to me, I think of any healthcare provider, anybody who relates to patients, can be a public health figure. It just depends on how you choose to practice. For example, I remember back when I was a student and I worked at a retail chain. It was a very popular one in Philadelphia. Um, and the pharmacist, the pharmacy manager there was just a very kind, caring person. She used to give, this HIV patients were her preference of treatment. And I mention that because I know you also, dealt with, initially with the HIV patients, the population. And we see firsthand from a community pharmacy perspective, sometimes these patients are not compliant with seeing doctors and they may not have the scripts or, sometimes, their life may not be as put well together as the most of us. And what usually, they would come no refills on their HIV meds. And usually, for most part, it's like, oh, you need to wait to get the refill from the doctor. Um, but this pharmacist, we were able to give a 3-day override as part of compassionate use. And she just, does give it to these patients without sometimes even sending it to the insurance because sometimes insurance would reject it. Um, and to me, that's a, a just a great way, right? Because if they don't take their meds, they could potentially get resistance, and then their CD count could, decrease, and they could kind of blast back into the AIDS section. So, that to me, that stuck with me, and I think that caring was a really great model for me to kind of practice. As you do it for the patients, not for the money, not for the business. It's all about the patients. Um, it just also reminds me of the patient that we saw last week, Dr. Johnson. I'm not going to divulge into the details of why she couldn't get her medications, um, but she had meds. They were definitely too soon to be refilled, but she wasn't taking them because she just didn't trust that these pills were safe for her.
Hmm.
Um, and her blood pressure was what, in the 170s.
Hmm.
Cholesterol was high. It's just rather than just like, okay, go talk to your pharmacy, because I kind of do remember the days where you can do that one-time override. There is a possibility to give patients, some medications that are too soon. It's just whether are you willing to do it, even though despite I understand the busyness, fast pace of a retail chain store, um, but thinking about it, like these patients need it. I made that phone call, and surprisingly, the one coworker, actually somebody that I used to work with, um, we went into the conversation. I know sometimes there's pushback. Explained the story, and we were able to work together and get that filled for her. But something like that, it goes a long way because I think this patient wasn't taking her meds for the last month because we saw her also back in was it January, I believe. So, yeah, she's got her meds, and to me, I think that's really what it's all about.
Hmm.
Um, what do you think? Like
Well,
for a public health figure.
yeah, for a couple of things. Not only do we have collective amnesia, we have selective amnesia. Yes, we as a nation forget the struggles of our forebears, the people who came to this nation. But we also selectively forget the struggles that individuals and individual communities had that are far different. The European immigrants that came were given free land. The enslaved people were given nothing when they were freed. And that's selective amnesia. So the disparity that we see in wealth is been ongoing for centuries, for several decades actually. So that's selective amnesia. And the other thing is this idea that um, we have to justify helping somebody who is poor. You don't have to justify. The Swahili proverb we learned is "Umsiongea na mwenye njaa." Never interview a hungry man. You feed them. And the example that you put forward, that you helped this woman get her medication, there are multiple reasons that a person does not get their medication. Some of them they can't afford them. Some of them they don't understand them, and many of them they just don't trust. Uh, these people have been exploited by the physicians, by the healthcare industry. I won't say healthcare system, healthcare industry, and so they don't trust it. So compliance is not just a matter of not having access. It's a matter of, can I trust this medication? Can I trust a person that's prescribing it for me? Can I trust a person that is filling it or manufacturing it? Again, historically, people of color have been experimented on. In the University of Pennsylvania, the Philadelphia College of Physicians, Johns Hopkins, all of these institutions literally use black bodies to experiment on. And so, and I'm sure you're familiar with the Tuskegee incident as well as the Panama incident and around the world. So we have to, as healthcare providers, build a relationship with our patients, which you demonstrated that with that patient. Build a relationship that they trust us, that we have no other motive than helping them. We have no other motive, and we want them to be healthy and whole. Again, that's recognizing their humanity.
Yeah. And, it just makes me think because certain ways we practice the things we know how to do, when to do, what to do, who to call. We do it very well in affluent neighborhoods. If you're a physician in that neighborhood or if you're a pharmacist filling scripts, they need to have their meds, right? Or all hell raises loose. So I think as people, we should do it anywhere. We shouldn't look at the area that we practice in and choose um, when to exert our energy to help them and get them their meds, help them to get their labs, their X-rays, whatever they need. So yeah, that's a really important focus. So and the purpose of saying that is, you know, if you're a healthcare worker, if you're somebody who's relate to a patient social service worker, um, you don't need to, you know, say I'm not a public health worker. Um, if you're in the Philadelphia region, come join us. Reach out to us, Miriam Medical Clinic. It's literally been formed by two people, a pharmacist and a physician. It still is, and it's still being run by these two great men. They are in their 70s, and they're working like 60 to 80 hours a week. So yeah, so lend a helping hand. Like even if it's 2 hours every 6 months out of your busy schedule, I think collectively that would make a big difference if we just have small hands helping here and there. Um, that would help the the patients, the people in the community to a great extent. Um, so, Dr. Johnson, I mentioned Miriam Medical Clinic. Would you mind just mentioning how you and Dr. Pitts, both are my mentors, how you two met and how this clinic was formed?
Well, we met. So it's a matter of our faith. We're both Christians, and that name has so many other names, so many other meanings nowadays. But we're followers of Christ. I'll put it that way. And we met through that. We as we were doing my wife and I better say this is founded by four people. I got to mention my wife and his wife also.
Yes,
I have to go
they're
home
very
sometime.
important. I think if not more important.
um, and so we met through that work. and we invited Neil to come to see us and visit us in Kenya. He worked with us for several occasions there, and that relationship grew to the point with that when we returned here to Philadelphia, we still had both had the same passion for doing this work here in Philadelphia. You'd first started going when we first formed Miriam. We started going to homeless shelters and even on the streets um, because we did not have a building, and then we got a building and we renovated that building. We were renting it, and they went up on the rent, and we kind of wandered around. We were homeless, as it were, for a bit until we settled on our site here in South Philadelphia on 2006 Tasker Street in the in the Point Breeze area of South Philadelphia. So we've been at this together, you know, this relationship over 30 years with this particular venture for the past 12 years.
Amazing, amazing. So now you guys are in South Philly. Um, and then could you talk a little bit about, so now, if somebody wants to volunteer and they say, well, let me look into liability because that's very important to me, about insurance and everything. Can you talk a little bit about that if folks have a little hesitancies on the
Sure,
insurance part?
sure. So depending on your skill set, medical assistant or physician or dentist or dental hygienist, and your degree of commitment. So we do want volunteers. We're willing to help with liability, but that depends on how long you're going to be committed because you can't pay a year liability for somebody who's going to be there a week out of the year. If someone wants to come and volunteer without being signatory to any of the documents, that's no problem. And we can do that without liability insurance. They would just be under our supervision. They would be performing in their capacity. Um, but the minute we get involved with actually signatory, then that will require liability. But Miriam Medical does cover that for those individuals. And we've had people volunteer for as much as a year, or just as little as 2 or 3 months. We have opportunities for students, and that's a wonderful thing. We have medical students, we have nurse practitioner students, we have nursing students, and they come and they work with us, um, both as part of their externship, but also as volunteers. So you can inquire obviously at our phone number 215-644-8745, and we will very well be very willing to accommodate you, fit you in any capacity that you see fit.
Absolutely. Thank you for that. Um, and I think also maybe another point of interest to mention too is the funding, because a lot of fundings were freezed or grants, um, based on, like some of the cuts to the federal funding and aid. Was the clinic affected by any of that?
So we are completely, so to speak, self-funded. I work full time, and then I volunteer full time. So we are not reliant on any government funds whatsoever. We have had a grant from the city to help build, but all of our funding comes from individuals who believe in what we do. And so our overhead, our expenses are completely funded by individuals who believe in what we do, and so we are not affected and by what the government does, city, state, local. We're not affected by that, other than getting the right licensing, etc. But our money does not depend on that. And again, because I volunteer, I don't charge the clinic anything, and and all of our people are volunteers. We have two workers that are part time that are paid, but they're not the doctors or nurses, and um, they're all volunteer.
Mm-hmm. Yep. Absolutely. Yeah. So as you can see, a lot of the overhead charges are eliminated. Um, and then an important part to mention too, because that was something that I was curious on, because you started by seeing patients without any mention of insurance, and over the past couple years, the clinic was able to take on insured, uninsured patients. But like a point to mention is that even if you have insurance, the clinic will not charge you for fees of seeing the doctors there. It the you had mentioned fees is only for labs and services like that.
Yes.
So I think that's amazing. Something I did not know, because some other free clinics in the area, when they say insured and uninsured, when you come to see them, they will charge your insurance. And then I don't know
So
about
yeah.
charging you, for a
So
fee.
we will, if you have insurance, we will charge the insurance, but we will not charge you a copay. So we don't want the copay to be because a $20 copay for somebody, that could be their groceries for that several days, or that could be their car fare
Hmm.
back and forth. That could be the gas that goes in their tank. So we do not want out of pocket expenses to interfere with your being seen by a doctor. So if it's out of pocket expenses, we don't charge copay so
Hmm.
far. And there is, because we're self funded, those out of pocket expenses would really not make a dent in terms of what we're you know our rent, et cetera, et cetera. So our building is owned by the church. They give it to us. We pay the taxes on it. We pay the utilities on it. And the 40, 50, 60, whatever dollars that people would give us doesn't really make a real difference. So we do not want that to be an interference. Maybe in
Hmm.
the future that will become something that we do, but right now and for the past 12 years it has not been.
Hmm. And then, and then sometimes, like, folks who don't have insurance are okay. All right. So your services are free, but what happens if I do, have to get lab work?
So
Am I going to
again,
be charged?
so it depends on, we can, in fact, we do pay for people's lab work. Um, and it's mainly basic lab work. Their blood count, their renal function tests, their the things that they have, kidney disease, et cetera, et cetera. We will pay for those things. Um, and so now for more elaborate lab work, we may have to go, make sure that their insurance is involved. Well, for people that don't have insurance, we'll pay for the basic lab work.
Thank you. And I was actually just searching just to make sure I have the right website address. So it's called miriammedical.org. So that's MiriamMedical.org. So miriammedical.org. Check it out. The phone number's there as well. Um, Call, because appointment hours vary, because Dr. Johnson's work hours do vary as well. So thank you so much, Dr. Johnson, for
Thank you.
talking with us about Miriam, and it's been a pleasure. Until next time when we rant about another purpose.
That's right.
All right. Thank you,
Thank you.
everybody.
Thank you, everybody. Thank you, Bob.